So I'm Dr. Mark Lindholm. Most of you know me, I think. But welcome to my presentation tonight. We're talking about our hyperbaric chamber that we have, our mild hyperbaric chamber. And so I want to welcome you to the class. I have some slides I'm going to go through and information I'm going to go through. But at the end, I am happy to field any questions you have. I'll either answer them or I'll direct you where you could maybe get answers. So what I thought we would do before I actually begin the formal presentation is I thought that we would actually do like a little field trip and just walk down the hall, because the actual chamber is just down the hall a little bit. And then you can see what the chamber actually looks like. I have a picture of it, but it's better to just see it in person since it's just like 30 feet or 20 feet down the hall. So and especially since it's a fairly small group, why don't we just go down there and I'll take a look at it and I'll just show you some things about it, and then we can come back and I'll actually talk about it. So, all right. So right this way. Have any of you used the chamber yet? No? No? Okay. So this is normally our massage area. So our massage therapists work here. But for actually about 3 years now, we've had a hyperbaric chamber, but a lot of people didn't even know we had it. It's on our website and everything. Yeah, okay.
Crossroads had one when Van Nash was there.
Ah, okay. Okay, I did not know that. So this is what it looks like. I actually should have turned it on earlier. It's not all the way up to pressure. When it's up to pressure, it makes a little psh noise because the air is constantly circulating through it. But just to give you an idea of the size of it, I wanted you to come in and be able to see it. Most of our patients, excuse me, I'm gonna reach behind you, they get their own like nasal cannula, which plugs into the other side of this adapter, which comes from an oxygen concentrator. So they put this in the nose, and they also get concentrated oxygen to their nose while they're in the unit. But just to get an idea of the size, when it's fully inflated, it's a little bit bigger, and I can very easily sit up in it. It's generally a treatment that's done by one person, but occasionally we have people that need a caretaker, like maybe a child that's using it, or potentially maybe somebody that has dementia or something that might need somebody to go in with them. You can easily put 2 people in this chamber. So,
and how do you get into it?
So I was going to show you the size, but I'll go ahead and do that. Let me turn it off. And this just unlatches.
Okay, so that's a zipper.
And this is a zipper, yes. And it just unzips. And then it pulls. This way. And so it's people either sit on this and then scoot in, or most people, when I personally get in, I just kind of roll into it. And when somebody's in use, this has sheets on it that get changed with every person. And it's got a wedge kind of a pillow here and another pillow. So a lot of people will use that wedge. And so they're kind of almost sitting up a little bit. You can just sit up in it. A lot of people take a nap in there. So it's very roomy and comfortable once you're in there. So, okay, great.
And how long do you normally spend in there?
So I'm going to talk about that in the presentation, but generally, to quickly answer your question, it's about an hour is the normal treatment time. Yes. So, but it takes, like I said, I should have started a little earlier. When we schedule patients, we schedule them for about an hour and a half because it takes time to come in, get you ready to get in the chamber. So we check your blood pressure, we do some screenings, update how you're doing, put you in the chamber, and it takes time to bring it up to pressure. And then the opposite when you get out, that's much faster. But as we let the pressure down, it takes time for that to happen to then be able to open it up and have you get out. So, yeah.
No clothes and stuff. There's no gowns and stuff.
Correct. Yep. So I'll actually talk about that. You're asking some good questions. I'll talk about that a little bit because there are different kinds of chambers, and for some kinds of chambers, the clothes you wear are important. But in here, just something comfortable is usually what we recommend.
What about magnetic? Anything magnetic? If you have magnetic watches or anything
that wouldn't hurt anything. Okay. No, that would be fine. Yep. Great. So let's go back out in the other room. I want to start off by telling you a little bit about the backstory, how we ended up having a chamber here, and why I think it's important to get this information out to people. So Hyperbaric is an extremely effective, very safe therapy that a lot of people just don't know about. I first got started with hyperbaric. So because chiropractors work with the nervous system, one of the things that we'll talk about is hyperbaric is very helpful in helping nervous system issues, whether they're chronic neurodegenerative problems or autoimmune problems like MS or cystic fibrosis, or whether they're subluxations causing nerve irritation or those kinds of things, that the hyperbaric can actually cause neurogenesis, new nerve cell formation. Can cause new nerve cell formation. So at chiropractic conferences, for a long time, I've seen hyperbaric chambers there and was familiar with them and what they did. But what really pushed me to get one is that my father, unfortunately, was diagnosed with dementia a number of years ago. And we took him to one of the leading dementia doctors in the country. His name is Dr. Amen. And he actually has clinics around the country that specialize just in brain issues. And one of the things that they recommended for my father when he was diagnosed was hyperbaric, that could help to slow the progression of the dementia and help with his symptoms. And so when we came back to Elkhart, my parents were living with me at the time, I contacted the hospital and they had a chamber that I will talk about in a second, that they had a hard chamber or a hyperbaric high pressure chamber, which is a little different from ours. But anyway, I was able to talk to the head of the department and explain to him that we'd been referred by a neurologist to do this hyperbaric. And he said, well, that's very interesting. But he said, Medicare won't cover that use for hyperbaric. And I said, well, that's okay. It'd be nice if Medicare covered it, but this is really important. We're willing to pay cash. And he said, we only will use the hyperbaric chamber for Medicare covered diagnoses, which dementia is not one of them. So the reason I start off about telling that story is that led us then to purchase a hyperbaric chamber, which initially for several years when my dad was living with us, we had at our house, and he used it every day. And I felt like it was really helpful. Dementia is not a curable disease, though. He passed away about a year and a half ago. But the value we saw with it and all of the research I did surrounding that treatment of my dad then led us to getting a chamber here. So our original chamber was a smaller version of what we have, and we upgraded to a much larger version that's easier for patients to get in and out of and so forth, that you saw just down the hall today. Okay, so that's kind of the backstory about how we started with hyperbaric. So I know you all saw it, but people that are tuning in, this is a picture of what our chamber actually looks like. It's actually from a company called Summit to See, which is a wonderful company. They have great support and have really high quality products. They have a number of products. This is just the version that we have. And ours is you'll see it abbreviated MHBOT, or it's referred to as mild hyperbaric oxygen therapy, or a mild hyperbaric chamber. And so what that mild means is that ours, for those of you that saw it live, is a softer material. I mean, it's actually very rigid once it inflates, but comparably, the type of unit that they would have like at a hospital many times, or sometimes at other facilities like hyperbaric facilities or even chiropractic clinics, would be a hard chamber or a deeper dive chamber, where the chamber would be made out of metal, and ours goes to 1.3 atmospheres. So the amount of pressure that you get means that one would be our normal atmospheric pressure, and then a 0.3 above that is the amount of pressure, whereas a hard unit would maybe go to 2 atmospheres, so double the atmospheric pressure, or maybe even there's some units that would go to 2.5, okay? So medically, a hard chamber or a higher pressure chamber would be used for things like carbon monoxide poisoning, damage from radiation from cancer treatment, where they're trying to get wounds to heal, or diabetic wounds that won't heal. We don't get much of this around here, but it can be used for people that have the bends or scuba diving injuries. There's a few other uses, but mostly it's limited to post-surgery, somebody that has problems with wounds healing. It's often used for those kinds of things. Sadly, though, there's a lot of people that should be using hyperbaric for all kinds of other benefits, but that aren't allowed, like I was mentioning, at most of the other types of units. The other, so we have a mentality, though, that, well, if a mild chamber at 1.3 is good, then maybe a 2.5 is better because it's a higher pressure. And what the research really shows is that's not true. There's a lot of conditions where some conditions where actually mild chambers are better. Neurological conditions that we deal with a lot here as chiropractors, and even like concussions, post-traumatic stress disorder, post-concussion syndromes, and just run-of-the-mill like sciaticas and nerve irritations. Mild hyperbaric seems to actually work better than some of the higher pressures. So it's not that one is better than the other, but they are used for different things. The mild chamber is also safer. So we'll talk about this later on, that hyperbaric is inherently safe, but the lower pressure is safer. But also one of the other differences that I skipped over is the higher pressure units normally are filled with 100% oxygen and actually pump oxygen, and the entire chamber is filled with oxygen. Ours doesn't work that way. Comes up to 1.3 and it's constantly circulating room air through it, and the extra oxygen is delivered directly to the patient through a cannula. The benefit of all hyperbaric is the oxygen getting into your lungs and then how it's distributed to your body, not that it somehow soaks in through the skin. So obviously oxygen is flammable. So one of the concerns or precautions you have to take with the 100% oxygen filled chambers are, like you said, clothing that you wear. You can't wear any synthetic clothing that might cause a spark, like polyester things. And there also is some risk, although it's a very low risk, of oxygen toxicity, it's called, and so forth. So none of those risks apply with our kind of a chamber, with a mild chamber. So I believe with everything we do here at Natural Family Chiropractic, that you always want to get the best clinical outcome with the lowest risk. So do the safest, least invasive treatment first, and that even carries over to what we chose to do here with our hyperbaric chamber. Okay. So I'm gonna, as I go through the presentation, just like cover different questions. So one of the questions that I think, that I hear often is, well, do you think I'd be a candidate for hyperbaric, or can mild hyperbaric therapy help me? So that's a hard question to answer. But I love this quote because it's very true, that hyperbaric cures nothing, but at the same time, it helps almost everything. So the basics of hyperbaric is you're delivering higher than normal oxygen at an increased pressure, which greatly increases the amount of oxygen getting to your tissues. So the way it works is actually it takes advantage of two laws of physics, one called Boyle's law and one called Henry's law. I'm not going to give you a physics exam. That's as much as physics as I'm going to mention, but you should just know that these laws of physics cause a gas, when it's compressed, to be more soluble in liquids. So normally the way our body works is when we're just breathing, like all of you sitting right here, you're taking in oxygen, but we take in much more oxygen than our body can utilize. That's the reason, like in an emergency situation, you can do mouth-to-mouth on somebody and save their life, because we're exhaling a lot of oxygen that our body doesn't utilize. You know, we have this idea we're exhaling all carbon dioxide, and we are exhaling some CO2, but it's a lot of oxygen. So what happens normally in our lungs is that the oxygen binds to our red blood cells, to the hemoglobin in the red blood cells, and that's how it gets around your body, is bound to the red blood cells. So what happens in a hyperbaric chamber, though, is that all of the liquids in your body become super saturated with oxygen. So your plasma, your cerebral spinal fluid that goes around the brain and the spinal cord, even your lymph fluid becomes saturated with oxygen. So you get perfusion It depends on which expert you read. I've seen everything from 10 times to like 300 times oxygen perfusion. I think it depends on how exactly they're determining that. But it's a super saturation of oxygen. And also we think, so obviously red blood cells are microscopic. They're small, but some of our capillaries and some of our, getting to some parts of our body, especially damaged tissue, it can be hard for red blood cells to get to those areas. So when you're super saturating the plasma, and your cerebrospinal fluid and all the other fluids, you get this oxygen being delivered at a higher level to all of your body. I wouldn't ever recommend this, and I don't know that this has ever been done, but theoretically you could put somebody in a chamber, take all of the red blood cells out, and they would stay alive as long as they were in the chamber because they could still deliver oxygen, okay? So it helps to deliver oxygen, which improves cellular energy and improves cellular regeneration and tissue repair are kind of the basics. We'll get into a little bit more detail here. So having said that it's hard to answer it, this list, which I won't go through the whole thing, is a list from one of the sites I'm going to mention later if you want more information, called hyperbaricexperts.com. And this is actually a list of all the links that go to research for different topics. That research has shown that mild hyperbaric can help with. So you see things like cerebral palsy and MS, fibromyalgia, things like wound healing, disease protection, or pre-surgery. So doing hyperbaric when you're getting ready to have a surgery to improve how your body's functioning to allow you to recover better from the surgery, or after surgery, wound healing. So even things like diabetes and depression. So lots of different things that it can help with. One of the things that you see first is aging. So interesting thing is that hyperbaric can be used even just for optimal health. Like you don't necessarily have any condition or issues, but can be used. And that's also, I think there's one that says protection here. That's kind of what they're getting at, is just using it for optimal health. So it's one of the true anti-aging things that we can do. For example, the research shows, I don't know if you're familiar with this, but when we look at aging, one of the ways that they can measure aging at a cellular level is genetically a shortening of what are called your telomeres. The telomeres are usually described by geneticists as a cap on our genes. And ultimately aging, when we get to the end of the human lifespan, is a shortening of those telomeres, which means then genetically our body doesn't produce new cells that are healthy anymore. And so normally most anti-aging things are trying to slow the rate of this shortening of the telomeres. Hyperbaric is one of the few things that actually increases the telomere length. So it actually truly at a cellular level is anti-aging. A lot of athletes use hyperbaric for recovery, like professional athletes, to help them to be able to perform at a higher level if they're a professional athlete. So as miraculous as this sounds, it is true though that hyperbaric, like lots of health interventions, takes time. It's an investment in time and money. So there's kind of a couple different categories I would place people in when we talk about how long does it take when you're undergoing hyperbaric therapy. So there's short-term benefits, which normally would be, some of these benefits you would start to feel or would happen after the first session. But I would usually recommend like 10 sessions is what we consider like a short-term kind of a benefit. And the kind of things we would see is like it lists here, improved mitochondrial function, which the mitochondria are the powerhouses of the cells. And because they produce the energy in the cell, it increases the health of the cell. Decreased inflammation, that's something that often people feel or notice like initially. And inflammation is the root of lots of chronic disease, as well as the root of a lot of painful conditions. One of the conditions that we see that that hyperbaric can help with is what they call long COVID, or people that have higher levels of spike proteins, which can happen from having had COVID once or multiple times, and can also has been shown to happen from the vaccinations or from especially repeated vaccinations. So some people really suffer with those long-term, and we know that the spike protein was extremely inflammatory. So the driving down inflammation with hyperbaric has been really helpful with people that have that. It causes hyperoxygenation, which improves healing, and then improved immune function. Those are things that happen relatively quickly in the hyperbaric treatment. So a lot of the conditions, though, that are more chronic conditions, they really need more long-term treatment, and long-term benefits for most chronic types of things like fibromyalgia or autoimmune problems, those kinds of things, are really not going to begin until about 20 sessions. And then for many people, they continue then to improve up to like 40 to 60 sessions depending on the person. So the kind of changes we see there are angiogenesis, which is new blood vessel formation, increased stem cell mobilization, which is your own inherent cells that can differentiate into other tissues and cause more permanent healing, increase in growth factors, actual tissue repair and regeneration. So not just reducing inflammation and helping you feel better, but really correcting the depending on the issue, correcting the problem more permanently. Mitochondrial improvements persist with those long-term things, and then neurogenesis, which is new nerve cell formation, which is really important to us as chiropractors. Okay, so this doesn't mean that you would get no improvement up to, like I said, when I say that long-term benefits kind of begin at 20 sessions, patients would often feel those other benefits that we talked about prior to that, but to get these kinds of repair takes a longer period of time. So frequency and duration. The other thing that's important is not only the number of sessions, but it's important how those sessions are done. That the normal frequency would be 5 to 6 days a week, or we would describe that as daily. And in some cases, we could maybe split that out to as little as 3 days a week. There's some more, the 5 to 6 days a week or daily is kind of the industry standard for hyperbaric. But 3 days a week, there's some research showing that can have very significant benefits also. If a patient said to me, which I hear this from patients sometimes, like, I only have, this much money to invest and I only have this much time available, so I'm gonna do whatever, let's say 20 sessions. Would it be better to split it up and do 20 sessions over a year, or to do 20 sessions 5 or 6 days a week? I would always say 5 or 6 days a week. And that's just because that's the way hyperbaric works, that these changes happen cumulatively as you do therapy. So the duration, as we mentioned before, is normally an hour that you're actually in the chamber. Although, like I mentioned there, but just for those of you at home, when you schedule an appointment here, there's a screening that we do every visit. We update your history. It takes some time when you get in the chamber to bring it up to pressure, and there's some time to bring it down. Everybody needs to use the bathroom right before they get in the chamber for an hour. So we schedule about an hour and a half. It takes about that long to door usually. Okay, and then the cost. Our cost for a single session is $95 if somebody wanted to try it out, or say maybe they tell me on Monday, oh, I'm having surgery on Friday, and they only have time to do a couple sessions. They might just purchase 2 or 3 sessions and do hyperbaric to get ready for that surgery. But most people would be doing packages of 10. We do a 10% discount, so it's $85 a session or $850 for 10 sessions. And we honestly, when we made the decision to bring the chamber here, we wanted it to be cost effective. So I know that this is not an insignificant cost, but if you Google hyperbaric and look up the cost, this is really inexpensive. Half the cost of most people, and even less than some other facilities that have the same kind of unit that we have. So we try to keep it as economical as we can. So it is an investment in both time and money. So when I'm talking to a patient about whether this is right for them, those are questions that we need to answer. Like, can you get an hour and a half out of your day for 3 days a week or 5 or 6 days a week, and can you do that for 2 or 3 months, depending on their problem? But it's important for you to know that if we recommend 20, 40, 60 visits, we're monitoring how that patient is progressing and making sure that this is right for them, making sure there isn't some other therapy we need to do or something we need to mix in. So as good as the results are with hyperbaric, we can never guarantee it's going to help 100% of our patients, but it helps a lot of patients where other things just don't. So I think an important question too that I want to answer is like, how long do these results last? So again, this kind of depends on what you came in with or what your problem was. If it was more of an injury or recover from surgery, then the treatment has a beginning and an end, and those results are permanent. So if somebody has a wound that's not healing, and we heal that wound and so forth. But if it's a chronic condition, or an ongoing condition, then hyperbaric might be something that we need to do longer, kind of as a maintenance a procedure. So you would still get all of those benefits, but if patients do a series of like 40 and then they don't do hyperbaric at all, they might notice that some of those problems from a chronic disease that we can't cure all the way might come back to some degree. So the good thing is that it's easier to maintain improvement than it is to achieve it. So generally somebody that would have a chronic condition where we're doing ongoing, it wouldn't be 5 or 6 days a week. It wouldn't be as frequent that we would have to do hyperbaric. All right, and then research I think is really important, and one of the great things about hyperbaric is there is a lot of research, but that research has changed a little bit. So I should have mentioned early on when I was just talking about the basics of hyperbaric, the hyperbaric is not new. The concept of hyperbaric has been around like since the 1600s. But during the 1940s is when like our more modern kind of hyperbaric was really expanded. Our unit, I mentioned, is a one-person unit, or potentially you could have a caregiver in there. There's plenty of room for 2 people. But there are some units medically that are a multi-person chamber where you might have 10 people in a much larger, almost spherical, like think a submarine kind of a thing. And actually, it's no longer in existence, but as I was researching to do this presentation, actually, there apparently was a spherical shaped hospital in the United States that actually the entire hospital was pressurized as a hyperbaric chamber. So, but I mention that because it's been around for a while, for quite a while, but the research has evolved over time. So if you look at some of the research, there were times when they would say, well, mild hyperbaric just doesn't do anything. It's not enough pressure, the person's not getting 100% oxygen, and the more current research has shown that that's not true at all. So if you want to just dig into it yourself, a great website is hyperbaricexperts.com. That's actually where that earlier list came from, and there's all kinds of hyperlinks. Yeah, you can take a picture of that if you want. Another great resource is Dr. Jason Saunders, who's a chiropractor, runs a large hyperbaric clinic, but also teaches or certifies doctors in hyperbaric, and he is a PhD also. And his PhD came about because of his work with hyperbaric. He actually wanted to do research on hyperbaric and on high pressure versus mild hyperbaric and so forth. But he has a great YouTube channel. It's just HBOT USA, and he has a lot of YouTube videos where he talks about all different kinds of things as they pertain to hyperbaric. And then a really important question with any therapy somebody's considering is the safety of it. So hyperbaric is inherently safe. It's has a great safety profile because, like I said, the basics of it are especially with mild hyperbaric, we're increasing the atmospheric pressure and adding extra oxygen, which has very few side effects. There's really only a couple contraindications. When you pressurize the chamber, you have to be able to clear your ears, like blowing and clearing your ears like you would on an airplane. And normally that's not a big deal. But if you have a problem where you're not able to clear your ears, then you wouldn't be able to do hyperbaric. It would just be painful to you if you couldn't release that pressure. Occasionally, if that happens here, my staff is all trained. We reduce the pressure, and then we slowly bring it back up and give the person a chance. The biggest reason why people have trouble is they just don't clear their ears soon enough. So you want to start clearing your ears as the pressure is first accumulating. If you wait until there's a lot of pressure and then you try to clear your ears, it can be more difficult to do. If somebody comes in and they have a cold or they having really bad allergies, they might have to do something like take a dehist or a antihistamine or something to help. But that's a contraindication. This has never happened at our clinic, but if somebody actually were to have an active pneumothorax, like think punctured lung, that's a contraindication because then your lungs can't equilibrate to the pressure change. The other one that's not really listed here, which sometimes can be a contraindication, although it's not like a medical contraindication, is somebody that has severe claustrophobia. That's why I started off showing you what the chamber looks like and so forth. So we have had one person that was all excited about doing hyperbaric, got here, saw the chamber and said, there's no way that I can do that. But like I said, our unit is rather large, so it doesn't feel claustrophobic when you're in there. I don't know if you noticed when you're in there, but there's two like windows so you can see out and so forth. So all of our hyperbaric patients also go through a screening. Every visit we check your blood pressure, we update your history, but also prior to even coming for your first session, we actually have an online like questionnaire that people fill out that's actually reviewed by a man named Dr. Ratanzi, who is a hyperbaric expert. So we do a screening of all of our patients. There are a few chemotherapy drugs that are that you can't do hyperbaric with the chemotherapy drugs, and actually the reason is because my understanding is that the drugs actually become more effective when you do hyperbaric, and so it can lead to toxicity or can cause them to basically be too high of a dose or too strong. But that's really rare unless you're under cancer treatment. All right, so I want to thank you all for coming, and I'm happy to field any questions you have if there's anything I didn't answer. Yes?
Are you familiar with PMR?
PMR? Yes, yes.
I had an injection of a steroid in my wrist, and it turned into PMR.
Yeah.
So I'm consulting, remember Dr. Anderson?
Mm-hmm. Yeah.
We're telehelping.
Oh,
He
wonderful.
said, yes, that caused it.
Okay.
Now, you gotta detox out of it, and it's an awful thing. It's really
Yeah,
hard.
it is. That is a whole.
Extremely painful. So they have me on steroids. So I'm trying to taper off the steroids. So, yeah,
Right.
that's why I wondered if that would help.
The potential would be great for hyperbaric. You saw me mention several times that both short-term and especially long-term, that it has an anti-inflammatory effect. So steroids, that's the mode of action, is reducing inflammation. But unlike the steroids, which the reason they're trying to taper them down is because they have health problems with taking them too long. You know, I have patients that take steroids for like I had somebody just recently with poison ivy, and she was taking some steroids, and she's like, wow, I feel so good. I feel like I'm 20 again. But I said, yeah, but you can't keep taking them forever because they have too many side effects. So anyway, so unlike that, the hyperbaric doesn't have side effects. So yeah, I think that'd be a great type of, you'd be a great potential patient for doing hyperbaric, yeah. Okay?
Talk to him about it.
What's that?
I'll talk.
I'll talk later? Okay. Are you seeing Dr. Hartman here? Okay, so he could definitely talk to you about it, or we can talk about it, yeah? Great.
Great.
Any other questions?
Yeah, is there, when someone's in the unit and they need, you mentioned like example, if they need to contact the staff or whatever, is there a way to communicate?
Oh, that's a really good question. I'm glad you brought that up. So every patient, when they get in the unit, we said the treatment time is about an hour. My staff sets a timer, but every patient gets a little walkie-talkie, and so we can communicate. And we also show patients those zippers that I showed you to open. I should have shown you, but on the front, there's a little dial that is like the pressure release we request that people have an emergency or they need to get out, they have to go to the bathroom, whatever is the most common thing, that they let us know on the walkie-talkie, we come and we get you out. But you can get yourself out. All you do is open that pressure valve, it deflates. Once it deflates, you can open the zipper. You just can't open the zipper when it's high pressurized because of the amount of pressure. So you have to, there's a little valve that you open. It takes maybe 45 seconds, 30 seconds for it to depressurize to where you can get out. So yes, that's a really good question that we monitor that closely. We also, even if somebody, if they haven't walkie-talkied us, one of my staff members goes in and says, hey, Marge, you doing okay? And everything to make sure that everything's going well. But yeah, people can get out and let us know and communicate with us. Yeah. Great question. Any other questions?
Have you seen any results with Crohn's?
We have not had a Crohn's patient here that we've treated in the hyperbaric chamber, so I don't have any direct experience with that, but hyperbaric is noted to help with Crohn's because it's both an autoimmune problem, which hyperbaric can help with, and an inflammatory bowel problem, like by definition. So, and it's usually with Crohn's, literally wounds in your colon. And so that's what hyperbaric is used for, as wound healing. So it should be very beneficial. And the research has shown that. I just haven't had direct experience with it here at the clinic with our chamber. So, yeah.
I'm actually a massage therapist.
Oh, okay.
So I'm kind of running through a lot of my clients and some of the things they struggle with. And one of my friends actually has a connective tissue disorder. It's called HSD, hypermobility sensitive disorder, something like that. Anyways,
I haven't heard of that one.
tissue doesn't support as well as it should, so our muscles are very hypertonic to help to pick up the slack where the connective tissue is not doing its thing properly, I guess.
Yeah.
Any rate, I believe that this helps everything, but
Right. Yeah.
anything, because you're a structure doctor, is there,
Right.
well, a neuro doctor, any thoughts on that?
So I'm not familiar with that disease at all. I would have to do some research. Is it a genetic-based disease? Do you know?
Yes.
Of all the things we've talked about, that's the one that that you've talked about tonight. I don't know about that. I would have to do some research because I'm just not familiar with that disease. So I don't know how much hyperbaric would benefit that. If there's an inflammatory component, if there's an autoimmune component, because it releases stem cells and increases mitochondrial function, I wouldn't be surprised if it could help even with a genetic-based disease, because it literally causes remodeling of your body when you're talking about connective tissue. But I just don't know enough about it to be able to answer if it could help. So
I have to believe that saturating and improving oxygen
Right.
saturation is good for everything.
right, exactly. Yes.
So,
Yeah. Great.
What kind of benefits do you see in Alzheimer's patients?
Just increased cognition. So with this is kind of personal, but with my dad short term, he would be better. His mind would be clearer right afterwards. And so sadly, dementia, conventional medicine, their treatment for dementia is largely geared toward medications that make the patient more manageable. Like if they're aggressive or if they, treating their symptoms, but don't really look at improving brain function. So the reason we took him to Dr. Amen is that they really look at what are the things that might have caused this. So with my dad, he had a number of things, some toxicity things, some heavy metal things from some chemical exposures, but he also had damage from basically it wasn't a stroke, but he had been on blood pressure medicine, and his doctor didn't realize that as he got older, he didn't need it anymore, and his blood pressure bottomed out so low that he in essence had almost a stroke situation from that. But a big issue also is he had undiagnosed sleep apnea. So at night he was not breathing, it wasn't getting oxygen to his brain. So a bunch of things like that. They look at nutrition. So hyperbaric was just part of what they recommended. And it was helpful. But honestly, with my dad, it got to a point where, as his dementia progressed a little bit, he would fall asleep in the chamber, and then he wasn't breathing because he had sleep apnea, and we didn't have a battery-powered CPAP machine that we could put in there, and so it after a while it didn't work so well, but at first it helped. Yeah. Great. All right. Yes.
When you start, like one session, you can tell maybe it's done something, okay? Whatever that be, whether it be like really wow or just a little bit. But if you're doing, say, the 10 sessions and you see improvement and do you go backwards? Am I understanding you kind of retain whatever you've gained, but you still have to keep going a little bit to retain the full function of everything you've already done?
So it depends on, like I said, what you're being treated for. Okay. If what you're being treated for is an ongoing chronic problem, then you probably have to do more. But no, you tend to maintain the improvement you get from those sessions.
Adjusts to whatever you're getting from those.
Right. And the beauty of hyperbaric is the healing actually happens largely not, I mean, you get benefit immediately. Like when I get out of the chamber, I kind of feel like Superman. I feel super energized. Some people, though, they get out of the chamber and they feel really relaxed and tired, and which is a really common thing. It's probably more common than feeling super energized. And because healing, so one of the things hyperbaric does is tends to stimulate your parasympathetic nervous system, which is think like digest and rest part of your nervous system. So sleep is very important for healing. So a lot of people feel relaxed and so forth. So people sometimes feel things immediately, but the benefit of this more cellular level happens as over hours after you get out of the chamber, not necessarily just right while you're in there. So it's that transition between hyperoxygenation and then your body going back to normal, and then hyperoxygenation and then your body going back to normal. It's that kind of contrast back and forth. And that's why, like, again, we sometimes think more is better. So I've had people say like, well, if an hour is good, can't I like sleep in it all night long? It doesn't work that way. There's diminishing returns and so forth, so.
But the benefit would be pulling it all the way this way, so you're kind of keeping all this intact, so to speak. I mean, whatever you've gained here continues to get better as you're doing down here. So if you don't do this, you may you may maintain some of this, but you're gonna lose some of it also. If you don't progress that way.
Yeah, if the condition is...
Okay, but the condition can get to a point where you don't need it anymore?
Correct, yes, yeah. So again, it depends on the condition you have. Yeah.
If it's not chronic.
Right, yeah. Okay, great. All right, well, thank you very much. I'm glad that you all came. And if you want more information, whether you're here live, you can feel free to talk to anybody at the clinic here when you come in, or schedule an appointment. I have patients sometimes that just want to do one session to kind of try it out. You're welcome to do that. If you're seeing this online, give us a call or check out our website for more information. I'd be happy to have you join us. Thank you. All right, yes. Thank you.